Hi, everybody. This is September meeting of the Human Services Committee of Community Board 2 Manhattan. We haven't met since June, so welcome back, everybody. I want to see, we're waiting for 2 attendees. Let's see if they're there. Emma, can you see if they're there? It should be. I don't know who okay, no, that's not who we're waiting for. We're waiting for LaQuisha and so we're going to wait just a little bit.
Good. Shall I meet us in the meantime?
And okay, my computer just doesn't really want to do anything nice. We're waiting for 2 people who are going to talk to us tonight about the Be Heard program. I like that. They are from the Mayor's Office on Mental Health. So while we're waiting for them, I can certainly go through the agenda and we can also introduce ourselves to anybody who's here. The agenda tonight is we're first going to hear a presentation by the Mayor's Office of Community Mental Health, which is separate from the New York City Department of Health and Mental Hygiene. This is under the purview of the Mayor's Office. They run a program called Be Heard, which is an intervention for people with serious mental illness. And we would like to know more about it to know if it's something that we think would be appropriate for our district. After that, we're gonna go into a couple of resolutions, one of which, both of them were shared on our calendar. One we discussed at our June meeting, which is about Bellevue Hospital. And one is new to this committee, which is about the use of masks by agents for ICE. What does ICE stand for? Immigration and Customs Enforcement. And then we're going to do really the most important part of our meeting, which is we're going to discuss our district needs statement, which is every year the community boards are asked to submit to the city a list of priority budget requests. Those are capital requests and expense requests, and I'm always confused about the difference between them, even though Mark has explained it to me 25 times. That's really the summation of our responsibility as a community board and as a committee. So we want to go over the meetings that we had in the last year, and talk about what our priorities are. I'd also like to, in this meeting, discuss our plans for the next year. A lot of interesting topics that we want to start to, all of these require planning because they're all initiated by us, not by the city. And so if we want them, we have to work on getting them. So the sooner we have identified those, the better it is. So let's just start with introductions. I still don't see LaQuisha here. Sorry. And Paki Kane also. I don't see them here yet, so we'll just keep going.
Do you want to promote? Oh, they're all promoted.
Is
Nicole and Carter.
You can promote Carter. I don't know that we need to promote Nicole. Nicole, if you want to be promoted, let us know, but usually she doesn't ask to. And that's that. Okay, let's start with introductions. I'm Susanna Aaron. I'm the chair of the committee. Janet
Liff, full board member.
Ryder Kessler, board member and committee member.
Emma Smith, board member and committee member. Julia Kay, committee member, board member.
Jean Berger, committee.
Arturo Fernandez, committee member, full board member.
And since we have a few moments before everyone here, let's also just mention the other committees that we're on. I'm also the vice chair of the Parks Committee.
I'm also vice chair of Traffic and Transportation.
I'm on the Street Activities and Resiliency Committee.
On Schools and Education.
Also you are an officer.
Oh, and the secretary of the board.
And I'm on Schools and Education as well.
And I'm on Schools and Education as well.
And I'm on land use and on the outdoor dining working group.
Right. And we still don't have our guests. Let's see if they are. Oh,
Here's LaQuisha.
Yay, LaQuisha. Let's elevate her to panelist. LaQuisha, you are going to be rejoining as a panelist.
And what's the other name?
Her name is Paki, P-A-K-H-I.
I'll keep an eye out.
Paki Grant.
Sounds good.
No, Pocky Kane. Why did I say, no, it's LaQuisha Grant, Pocky Kane.
Okay.
LaQuisha, can you hear us? See if you're with us.
Do you want to check attendees to see if the in-panelists?
Yeah.
No, she's been promoted.
So, hi Sherry, nice to see you here. Sherry is with SHAP, which is a meeting we're gonna have next week, the Street Homeless Advocacy Project. LaQuisha, when you're on, can you let me know? Can you holler?
Hi, can you hear me?
I can hear you. I don't know why I don't see, but I can hear you. I will soon see you. Are we being joined by Pocky or is it just you tonight?
So I'm here and, oh, I can see you guys.
Hi.
Hi. We're joined by my colleague Simone Watson. And
Okay, give me just a second. We're gonna go to the attendees and elevate them. Simone Watson, yep.
And Pocky may not be able to join. She had a little family emergency. She's going to try and get on.
Okay, that's fine. Is there anyone else that needs to be elevated? No, okay.
No, that's
You and
it.
Simone, terrific. So as I said before you arrived, the point of, thank you so much for joining us. I know you have a busy schedule and it's very kind of you and accommodating for you to come to us. We've heard a lot about the Be Heard program. We know that Eric Botcher has advocated for it, but we don't know very much about it. And this is the time of year when we make our budget requests. So this is perfect timing for us to hear about it. Hi, Simone. I don't know if you want introductions. I'm Susanna, Janet, Ryder. This is Arturo. This is Keith. This is Juliet. And this is Emma. So do you guys want to take over?
Yeah, sure. Thank you. It's so nice to meet you all, and I'm happy to be here and finally be able to do this presentation for you all. Thank you, Susanna, for reaching out to us and for the conversations leading up to this. So I'm LaQuisha Grant. I'm the Deputy Executive Director for Mental Health Access at the Mayor's Office of Community Mental Health. And I'm joined by Simone, who's on my team. Do you want to introduce yourself, Simone?
Sure. Good evening, everyone. My name is Simone Watson. I'm the Senior Director for Mental Health Access and Crisis Response with the Mayor's Office of Community Mental Health.
Just give us 3 sentences on what the Mayor's Office of Community Mental Health is. It's different from DOHMH, right?
Yeah, so that is actually part of our presentation. So let me get started on that.
Jump the gun.
And apologies, my computer is a bit slow, so it's just taking longer for everything to load and to happen. But pretty soon you should see a PowerPoint slide.
There we go.
Good. You see it? Okay. So why don't we jump ahead? So just a quick agenda for today. I am actually going to give an overview of the city's mental health crisis system, which includes Be Heard, because I think it's really helpful for folks in order to understand Be Heard, it's really helpful to understand how Be Heard fits within the larger system. And so a little bit about our office. Our office was chartered, was added to the city's charter in December of 2021. So right at the end of the previous administration. And so we are charged with lowering barriers to both mental health and substance use care and engaging with communities to really promote mental well-being. And what that looks like practically is working across city agencies. And so we work very closely with the health department, with New York Health and Hospitals, H+H. We work very closely with DHS to really kind of close those gaps between the people they serve who need mental health services and the actual mental health system, which is like more traditionally the health department and H+H, right? So the way that kind of our office was introduced to Susanna is that we participate in a lot of the community-based task force that are set up to address quality of life issues. Particularly, we come in and to kind of provide support for individuals in those communities who need either mental health or substance use services. So we'll work with the Department for Homeless Services to provide to help connect those folks to housing, or we'll work directly with community-based organizations that provide mental health and substance use services to make sure they're at the table and helping out to address these issues and the communities that they serve. And so we really have a bird's eye view of the entire mental health system. And we have 4 priorities that our office focuses on. It's improving access to mental health care and the equitable distribution of resources. So we create a lot of resources that has information about available mental health services, and we do a lot of public education about available mental health services, because here in New York, we are fortunate enough to have a wide range of different types of mental health services. What we found, in the barrier that we're trying to address, is that many people don't know about them. Many people don't know they exist. And so that's why that's one of our priorities. Partnering with communities to elevate mental health promotion and community resilience is really about empowering communities to care for each other and their neighbors, and really uplifting those natural supports in communities that are already doing great work to address the mental well-being of their neighbors, really kind of elevating that work and providing any sort of supports that's needed to do that. We are very much focused on supporting the mental health workforce. Some of you may know we are experiencing a mental health workforce shortage. It's a bit of a crisis. It's not specific to New York City, but here in New York City, we really, we feel the impacts of that more profoundly, especially in the public sector when it comes to mental health services. So, and particularly after COVID. So we are working to really to grow the pipeline of people entering the mental health workforce and to strengthen the current workforce. And last but not least, our other priority is around developing a coordinated mental health crisis response system. And that is kind of where our work with the Be Heard program sits. It's under this priority, and it's what we'll spend some time tonight talking about. So when we think of, when we think of a comprehensive and a coordinated mental health crisis system, we think of, and these guidelines are outlined by SAMHSA, which is the Federal Administration for Mental Health and Substance Use Services. But they say that in order for a jurisdiction to have a comprehensive mental health crisis response system, there needs to be someone to call, someone to come, and somewhere to go. So here in New York, we fortunately do have all 3 of these things in our mental health crisis system. The challenge that we have is that not all of the pieces of our system are coordinated. So, and also some of the services are a bit sporadic. So not all of these services are available 24/7, but we know that mental health crises happen 24/7, right? And so the work that OCMH, our office, does is to try and kind of expand those services and really knit the pieces together so that our system is a bit more coordinated. And so I'll go into details here. So when we talk about someone to call, we think about first people's natural supports, right? So if someone is having a mental health crisis, the first line of defense, if they have it, is going to be their loved ones. It's often their neighbors. It could be their co-workers, right? And so we try to educate folks that those natural supports are truly important and really meaningful to the crisis system. In addition to that, we have access to 988, which I'll go into more details about, but it is a 24/7 mental health crisis line. It's a national number. Here in New York City, we have a very robust 988 call center. And we're able to not only the crisis counselors who address those calls are not only able to resolve most kind of crises that come into the system through just kind of talking with an individual, but if necessary, they can also deploy teams that go out and respond to folks who are having a behavioral health crisis.
Lavisha, someone was just about to take a photograph and I thought, can we get this presentation after this meeting?
Yes, and this infographic actually lives on the health department's website. I was trying to find the link for it before I got here, but I couldn't find it. But we will make sure.
I've seen it before, but I have no idea how I got to it. So
I know, right? It's same here. It's hard to find it on the website, but this is just the first page of it. So the next page of it actually goes into detail about all of the services listed here. And so it's a really great resource. I'm gonna try to get you all the link, but definitely make sure you have access to this infographic. So 988 is a great resource. 311 is also a resource for people who are unhoused and might be experiencing a mental health crisis, right? And sometimes you don't know, right? So if you encounter an individual who's unhoused and you're not sure if they may or may not need mental health or substance use support, you can call or use the 311 app and report what you're seeing, and a homeless outreach team will come and assess that individual, try to connect them to housing or to any other services that are needed. If they need, if they need care, they can also facilitate that emergency care. They can facilitate that through 911. Oh, great. Thank you. I see someone put the link in the chat.
Hey, Arturo.
And so 311 can dispatch homeless outreach teams. 988, they can dispatch mobile crisis teams if someone does need in-person support. The mobile crisis teams the next set of slides go into a little bit more details about all of these, but just the high level overview so that you have some familiarity with the services listed here.
And when you say mobile crisis team, I mean, we've heard of IMT, we've heard of a lot of different kinds of mobile crisis team. And you're just saying sort of generally as a catch-all term, you're not specifying any specific one.
No, so that's a really good question. So
there we go, look at that.
Mobile crisis teams is, and I know in New York, in the healthcare world, we love our acronyms. It's so confusing. But IMT teams are not actually, they're not the same as mobile crisis teams. IMT stands for intensive mobile treatment, but they are not teams that respond to people who are in crisis. They serve people they provide long-term treatment to people who are on their caseload, and they're called mobile because they actually go to where people are, but they have to be on your caseload, right? And so there's like a referral process and an assessment, and it's a very high bar to be able to receive both IMT services, and if you're familiar with ACT, assertive community treatment, that's another one that
That's the state version of it, isn't it? ACT?
ACT teams are state licensed, but they are contracted through the city. And
All right, one more question without confusing everyone too much. A mobile crisis team, is that under the purview of DOHMH, of CMH? Like, who oversees those?
they're under the purview of DOHMH, but also similarly licensed by the state. So the state provides the licensure for pretty much all, treatment and mental health services. IMT is slightly different. The city created IMT to mirror ACT, but to provide more flexibility, because with licensure, you have kind of like limitations, which, makes sense. There are regulations that govern the type of care that people receive. ACT, you're able to bill Medicaid. And so that also creates some kind of restrictions and limitations. And so the city created IMT, intensive mobile treatment teams, to kind of mirror ACT, to provide the same level of like intensive treatment and long-term treatment that ACT does, but with more flexibility. And so the two are pretty similar, but IMT is just a little bit more flexible. Now, mobile crisis teams, these teams operate 7 days a week, and they're able to respond to people within 2 to 3 hours. And these teams are predominantly deployed through 988. So any of us can call 988 if we have a loved one that we're concerned about, and we want to try and get mental health professionals to go out and check on, or assess this individual. The limitation with mobile crisis team is that the person does need to have an address, and that's because they respond within 2 to 3 hours. And so if there's no address, if you're calling for somebody who's on the street, then they might not be there in 2 to 3 hours. And so then a team will have been deployed and they won't find, the person they're looking for. So in order to kind of really, get the best use of this resource, they do require an address for the person in crisis. But they operate 7 days a week, including holidays, 8 a.m. to 8 p.m. And if you'd like to request a team, you can call 988 and explain what's happening and ask to see if it is appropriate for mobile crisis. Or if someone is calling 988 and just describing a situation, the crisis counselor might recommend that a mobile crisis team go out and see them. So,
and what happens after 8 p.m.? Like, I'm gonna guess that at some point you'll tell us what you do if it's after 8 p.m. or before 8 a.m.
Yeah, if it's outside of the hours that mobile crisis teams respond, you can still call 988 and request a mobile crisis team. They just won't come until the next day.
Okay, so that's a good situation if there's someone who is like a neighbor or in your house or something like that.
Yes.
Not for people on the street.
Not necessarily for people on the street, but I do say I will say though, for organizations, for like a community board, if you have someone that that's constantly like in a location, like maybe at a food pantry, at a church or something like that, you could possibly use the church's address, right? Like there just has to, if you know that person is going to be at a physical location for an extended period of time, you could try to get a mobile crisis referral.
Got it.
For that individual.
Dana has a question.
And just fill in Suzanne's question.
Sure.
Are you going to, you can't prescribe, be sure that people aren't gonna have a crisis between 8 and 8. So
Mhm.
you'll get to what happens if someone's having a crisis at 10 or 11. You can't wait till the morning.
Yeah, so let's go. Okay, I think we start with 988, right? So again, you can still call 988 24/7. They can speak to a crisis counselor, and these crisis counselors are really good at resolving issues right there over the phone. I think somewhere upwards of 80% of all kind of crisis situations that these crisis counselors respond to are resolved right then and there over the phone. So they can, if it's outside of, the mobile crisis team hours and the crisis counselor suspects that this does need like an emergency response, they might refer you to 911. If it's an emergency, they probably will refer you to 911. Another option, let's see, where do we have, that was the mobile crisis team. So another option, and we have a slide with some information about it, is Express Care. Well, here, why don't we go back to this? So not mobile crisis is just one of the things that 988 can refer someone to, right? Another might be a crisis residence or a support and connection center, which a support and connection center, there's only one in New York City. It's in East Harlem. It is open 24/7, and it provides both mental health and substance use treatment for individuals. Very low barrier to entry, but it's a very warm, home-like environment, but with a lot of treatment services, occupational therapy, lots of great services and supports for individuals. They can stay at the Support and Connection Center, they can stay for up to 3 days while the staff there try to find long-term treatment options and long-term housing if that's what's needed. But again, and the Support and Connection Center is operated by DOHMH. The state is in the process of standing up it's called crisis stabilization centers. There's going to, as of right now, there will be 2 in New York City, 1 in Brooklyn, and 1 in the Bronx. Also, again, open 24/7. Those will accept walk-ins and also provide the same amount of clinical support, mental health treatment, substance use treatment. So those are in the process of coming on board. But again, these are like this is like a part of the system where there's a gap, right? Like it's a great service, but it's not available in every community. And so that's something that we're working with the state on, is to like try and identify more opportunities to stand these up. It's a little tough for a number of reasons, but it's something that we know is a really good service and that many communities can benefit from.
I have a short question, which is the MCTs, are they contracted by the city or are they actual city employees?
Most of them are contracted. So some of the providers that most of them are actually H+H contracted. And so they operate out of Health and Hospitals, CPEPs. And so So Bellevue, for instance, has a mobile crisis team.
Got it.
And
Okay,
then some of them are just community-based organization, behavioral health providers. So like VNS Health is a large one, for instance, that most people are familiar, an organization that most people are familiar with that has mobile crisis team. They also have children mobile crisis teams in each borough. And those are all of the children mobile crisis teams are contracted out to various providers. So in Manhattan, it's ABC is the provider for children mobile crisis teams. So and then 988 can make referrals. The main point about 988 is that there's a myriad of options that 988 can refer folks to. And so we like to think of 988 as like the best front door into the mental health system. And so we really, encourage folks to become familiar with 988, with the phone number. You don't have to know anything about the services they provide. If just know that if someone needs mental health support, call 988 and a crisis counselor will help figure out what the most appropriate support is. But we do know that for many people still do not know about 988. Many people call 911 when when they encounter someone experiencing a mental health crisis. In fact, and this kind of ties into, we've learned this from operating Be Heard, that the overwhelming majority of 911 calls for someone having a mental health crisis comes from a second or third party caller. So it's not the person themselves that's in crisis. It's someone else describing what they see, or calling on behalf of a loved one, knowingly or unknowingly, right? And so that creates, and so we know that this happens. We like to encourage people to call 988 instead, because if it turns out that 911 is more appropriate, then the 988 call taker can get you over to 911. And so 911 should be used for life-threatening emergencies. So if someone is at immediate risk of harming themselves or others, or if someone is in imminent danger. But know that when you call 911 for mental health calls, the traditional response will be a combination of NYPD and EMS. In some cases, you may get a Be Heard team. And so Be Heard is the city's mental health emergency response. So it's the only kind of mental health, like purely mental health, the only mental health response that we have out of the 911 system. And so the goals of Be Heard is to route 911 mental health calls to these teams, which seems like an obvious thing, but we are talking about a really large, complicated 911 system. So being able to even just get the calls get the calls to a 911 team is no small feat. And it's something that we have to continue to improve upon. Another goal is to increase connection to community-based care. And so through Be Heard, for the first time, people have an option to go somewhere other than a hospital. So when you call 911 and you get a traditional NYPD or EMS response, the only options available to you are to go to the hospital or are refused medical care or nothing at all, right? Be Heard introduces an option to go to like a support and connection center, for instance, or to be connected to your existing treatment provider, which quite frankly happens very, very often when Be Heard responds. When they engage with someone, they find that this person is already connected to the mental health system and has a treatment provider. And so the clinicians on the team will call that treatment provider and, facilitate that, let the provider know that, hey, your client or your patient had a mental health crisis. Can we get them in to see you ASAP? Another goal is to reduce unnecessary transports to the hospital. So again, because in the 911 system, the only option is to refuse care or go to the hospital. Often people go to the hospital because that is the only option available. With Be Heard, we've seen a reduction in that. And we'll talk about that a bit later, and reduce unnecessary use of police resources. So Be Heard teams are able to respond to 911 calls without NYPD. So when a call is going to be routed to Be Heard, a communication goes to NYPD saying, hey, you're not needed for this call, don't go. And this is the first time that we've been able to do this here in New York City, is have police stand down when responding to mental health emergency calls. So Be Heard teams are comprised of two EMTs and one social worker. They ride in a Be Heard vehicle as a team, responding to calls that meet criteria. So the Be Heard teams respond in order to be eligible for a call, to be eligible for a Be Heard response, there has to be no violence or weapons, because again, these teams are responding without police, and so they're not really equipped to respond to violent situations or situations where someone has a weapon. No imminent risk of harm to self or others. So if a person is exhibiting or is talking about suicide, a Be Heard team is able to respond to that. However, if someone is in the act of potentially committing suicide, then that requires a more tactical response. And so Be Heard would not respond to that. The Be Heard teams do not respond to kind of drug overdose calls because those situations tend to be more medical in nature, and they need to, that requires a very urgent medical response. So that, typically a transport to the hospital, an immediate transport to the hospital. So they don't respond to drug overdose calls. And, as you all know, Be Heard is limited to right now 31 precincts. And so before I get into that, just one more, I'll talk a little bit about what the teams do when they come. So on scene, they first provide a physical health assessment, right? The EMT, and that's why we have the EMTs on the team. Because these are 911 emergency calls, we have to ensure that there's not a medical emergency. And often we know that some medical emergencies can present as a mental health emergency. Like, so someone has an extremely elevated heart rate. They need medical care immediately. So, that will take precedent over the behavioral health situation. And so first the patient has to, complete the physical health assessment. And from there, the social worker will take over and do a behavioral health assessment. They can provide assistance on site. So they de-escalate, whatever mental health crisis situation is presented to them. And also part of what they are assessing for is whether or not someone does need to go to the hospital for further evaluation for their mental health, for the mental health crisis that is presented, because and that is the case very often. So our goal is to reduce unnecessary hospital transports, but quite often it's more appropriate for a hospital to get, some people will need a more comprehensive psychiatric evaluation. And so it's a social worker who's making that determination and then facilitating the transport to the hospital in those cases. But again, in many cases, the teams are able to de-escalate the crisis situation right then and there. They will provide a referral to ongoing treatment if necessary. They will facilitate transport to either a support and connection center or to some other mental health or substance use facility if that is not a hospital, if that is appropriate. And that's what we talk about when we say they refer to community-based care locations.
So I have a question about Be Heard.
Sure.
Does it do any auditing of its success rate? Like, how does it measure? It all sounds so great, but how does it measure whether it's working and whether it has gaps? How does it monitor itself?
Yeah.
Maybe it doesn't.
But no, trust me, we spend a lot of time looking at the data. And so we kind of measure ourselves against kind of these three goals, right? So routing 911 mental health calls, for instance. So we look at how often the teams are responding to mental health calls that are actually eligible for Be Heard. What we have learned is that a large portion of mental health calls that come into the 911 system are considered ineligible for Be Heard, partially because of one of the things that I talked about earlier, like the second and third party callers, right? So when someone is calling Be Heard on behalf of someone that they don't know or someone that they see on the street, they typically don't have enough information for the 911 call taker to assess whether or not this is going to meet the criteria for Be Heard. Another gap that we see is just that there's not enough teams. There aren't enough teams to respond to every single call that is eligible for Be Heard. And part of that has to do with initially had to do with the mental health workforce shortage. We have been able to do a really good job of recruiting social workers for the program, but it's not a typical social worker job, right? Most people who go to social work school do not envision themselves sitting in an ambulance type vehicle all day, responding to 911 calls. And so that has been a challenge. But then also on the EMS side, staffing has more recently become challenging, mainly because every few years, the fire department puts out a firefighter promotion exam. And many of the people who apply for that exam and get promoted to firefighters are EMTs. And so every few years in New York, the fire department loses a good chunk of its EMS workforce. And so we are now starting that exam, I think just came out, happened recently. And so we are starting to feel the effects in terms of EMS staffing of that exam. It's going to get even worse as more people or more EMTs get promoted to EMS. And on top of that, EMS has already, and I'm sure you guys have seen this in the news a bunch over the past year or so, but response times for EMS have gone up across the board. And so it becomes hard to justify having EMTs that are dedicated to only responding to mental health calls, especially when mental health calls are rightfully a low priority for EMS because they are responding to medical emergencies like heart attacks or, someone bleeding out, that sort of thing. So staffing the teams has been a challenge, and it's kind of reflected in the number of eligible calls that the teams respond to. And Zachary, I see your hand up.
I think Ryder had a question, right?
Yeah, I mean, Zachary did raise his hand, but I'll go first because I'm here. I have two questions. I mean, I think the first, I'll just point folks, if they haven't read the comptroller's office audit from earlier this year that really dug into the data about Be Heard and the fact that, about 35% of the eligible calls ended up not getting responses from Be Heard. And totally get a lot of the calls are deemed ineligible because they might have a dangerous element, and then other calls, they don't get all the information to qualify them, or they come in the wrong hours. But I just want to really dig into the calls that did not get a response that would have been eligible. What I'm hearing is that that is because of insufficient teams, which is a reflection of lack of staffing, either from budget or from people being allocated to other emergency response. So I just want to confirm, because for us, it's what can we be advocating for to make sure those eligible calls do get answers? Would it be us saying spend more money? Would it be us saying, prioritize this for the EMTs you have? That's one question. I think to Susanna's earlier question about measuring outcomes, I did see really interesting data from patient surveys where 99% of people who got Be Heard outreach said they liked it, and 96% of people said it was helpful. But I do you have data collection about kind of what happened to those folks, ultimate connection with long-term care or long-term kind of case management, or is that still a gap that's being filled? Thank you.
Yeah, no, those are great questions. Thank you for the questions. So in terms of kind of the calls that are eligible that Be Heard is not responding to, yeah, it is a combination of kind of all of these things, staffing. So even with, with unlimited resources, I'm sure we could make anything happen. But it's not just the dollars thing, right? And even with more funding, having more funding doesn't really address the EMS shortage. Now, if there was a ton more funding that went to EMS and to FDNY, I'm sure they could figure out how to hire, however many EMTs they need to adequately, to better respond to all 911 calls, including Be Heard. But
it's a matter of a pipeline also, as you said. It's not just having the money to hire them, it's also kids going to school to do it and people becoming choosing to become an EMT. So there's a whole pipeline issue to stick to.
Right. And we don't, and both on the social worker and on the EMT side, we don't, the teams are staffed by experienced EMTs and experienced social workers. So it's not, so they go through 4 weeks of training jointly. but to even be eligible, you have to have some years of experience in the field. So it's not like we could just have like an EMS, a new EMS class that would automatically, work on Be Heard teams, because we've learned from, jurisdictions across the country, and we've seen this, it's better to have people who have some experience in the field responding to mental health calls for this population. So, yeah, so funding is just, so it's not a matter of just having, more money. I think there has to be kind of a long-term plan for getting both social workers and EMTs equipped to do this sort of work. Long term. And then your second question was about outcomes. Yes.
Outcomes, right.
Health outcomes. So that's something that would that question lends itself to an evaluation, which, at this point, and I failed to mention this has been a pilot program since June of 2021. So for a few years. So at this point, we could potentially meaningfully evaluate the program, but we don't look at long-term outcomes as part of how we measure the success of this program specifically, because this is purely an emergency response. And so that's kind of how we measure success of the program right now. But an evaluation would lend itself to looking at those kind of long-term outcomes, and to look, and wouldn't be a very easy evaluation, because we'd have to look at, because of HIPAA, and so we'd have to look at, there have to be some willingness for people to share their medical records for an evaluation like this, but it is something that is definitely that we've talked about, and that we would like to do eventually.
Thank you.
So I know you're going to go to the next slide, and you're going to show us all the precincts that have it, and obviously none of ours do. If you have a Be Heard team in your precinct, and you call 911, I'm going to guess that the Be Heard teams are assigned to precinct areas. Is that how that works?
Initially, so you'll see here, it says that Be Heard operates in 31 precincts and surrounding areas. And that is because we have removed like these artificial precinct boundaries that govern where Be Heard responds. So initially we used precinct boundaries because it's a pilot, and so we were growing slowly, and it was just easier to kind of like look at things artificially by precinct. But the reality is the 911 system does not really operate by precinct, especially FDNY. FDNY they don't deploy resources based off of precincts, and so to be more aligned with the way that FDNY deploys resources, we have removed the precinct boundaries. However, we still have the teams kind of stationed in these kind of high priority neighborhoods and communities. And though these communities, these precincts were selected based off of the volume of EDP calls for EDP, emotionally disturbed persons, is how both FDNY and NYPD categorize what we would consider most mental health calls. It's not a clean definition of mental health calls, but these precincts, most of these precincts initially had the highest volume of EDP calls. And and really EDP calls that didn't require or were less likely to require kind of police resources or an immediate transport to the hospital. And that's important because the Be Her teams do not transport to the hospital. If they encounter someone who needs to go to the hospital, they have another ambulance come and provide that transport. So for situations like drug overdose, where somebody needs to go to the hospital immediately, then that's not going to be the type of call that's eligible for Be Heard. And so we kind of excluded those types of calls when looking at, you know, high need. And so with the removal of these of the police precinct boundaries, I can say that Be Heard has responded to calls in your district. Not many, because the way that it works is that they're still stationed kind of in these same communities. But if a call comes in, so let's say we have a team in Harlem. If a call comes in, if they are responding to a call in Harlem, and then the next call that comes in is in the Upper West Side, they can leave Harlem, go to the Upper West Side, even though you won't see like an Upper West Side precinct reflected here on this page. They'll go to that call, and then maybe the next call that comes in, because they respond to calls within, like, they have to be able to get to the call within 30 minutes for it to be eligible, for them to be able to respond to it. So then the next call that comes in would potentially be in Midtown, and then the next one might be in the Village, or so.
But there isn't a dedicated, I mean, I can appreciate that this map is based on data. It's based on calls coming into precincts. I notice, you know, that there is nothing in Midtown at all and nothing in our district at all. You know, we don't know what it's like in the other districts, right? Because we just see our district, Penn Station, Port Authority, Washington Square Park. So, you know, for us to look at this, obviously, sure, someone from Upper Manhattan might eventually drift into our area, but say it's unlikely that that's going to happen too often. And from where we sit, we feel like it might be a really good thing to have one station in Midtown that would be more flexible for East Village, West Village, and so on.
Yeah, that is definitely, I could understand why you would advocate for that.
Yeah, no, I wouldn't argue with that. It's just, you know, you wonder, we see a lot of what looks to us like a high volume of mental illness, use. You know, we're not the experts. We don't have that high view. We just see it from our perspective, but it does look like a big white gap on that map. And I appreciate all the reasons why that map is the way it is. But of course, we also wonder, you know, have things changed since 2021? And are there funding, you know, restrictions that are at play? Anyway, all right, that's good to know.
I see Carter's hand up.
Oh, and I don't see anybody's hand.
Also, Zach had raised his hand at some point, but he might have put it down.
Zach, does your hand up?
No, she answered my question.
Okay. Carter?
Yeah, my question is, you know, when the police receive a 911 call, they're often alerted, from my understanding with talking to some of the local police officers, that a location is sensitive for EDPs. And I'm wondering if Be Heard is automatically notified beforehand or at the same time along with that, so that they're aware that they may get a call, or if there's any way to integrate that more comprehensively into the program so that they're aware, because there's obviously sensitivity for putting people's names on any lists, right? But this gets them there in real time, not necessarily when they're directly asked to come, which is probably a little bit into each of the incidents.
So I think the difference is that the Be Heard teams are only responding to EDP calls. And so they definitely know that. So the call has been, when it comes into the 911 system, it gets triaged. That the NYPD and FDNY call takers ask a set of questions to kind of determine what the most appropriate, emergency response resource to deploy will be. And if it meets the criteria, and if a Be Heard team is available, it can be heard. In terms of knowing, so there are EMTs who are responding to these calls, right, that are part of these teams. And so they have, access to the same kind of, it's called the CAD system that all EMTs have. And I do believe that, similar to NYPD, certain locations might flag as like frequent places that are frequently visited. But so they will have a sense if it is one of those, like for instance, if it's like a shelter, they may know that, they may have that information available going into it, but I'm not sure if that answers your question.
Yeah, I guess it was just more of getting it sooner, right, to mitigate the situations before they escalate, which when I've seen things, they escalate, and then, it just takes up a significant amount of resources. But if there's a Be Heard team and connecting people, sooner, it's better for everybody because the system works better. So I guess that's what my question was, because in my area, and you brought up a great point, like near shelters, for example, all the police know those locations, but there are a few in my area where there's some mental health issues with some individuals, and the cops know that. But it just seems to me that it could be a better integration of the existing system if people are knowing this beforehand, and other resources. Because I'll just put it into real world context. It's uncomfortable for all of the public to suddenly see 4 police cars right on top of a situation, and then it takes another 20 minutes for something to happen, and everybody's there, and it's not comfortable. And it's not comfortable for the individual who might require services, for the public, for the police officers. I guess that's where I just bring that up from, because that's where we all see this, and that's probably where those calls originate from, right? To say, hey, there's a problem, et cetera, from a bystander. So that's where I was thinking of that. Coming from with that question.
I'm going to guess, LaQuisha, that if there were a Be Heard team assigned to somewhere in your vicinity, that is something that would address Carter's concern, right?
Well, to some degree, I mean, the reality is that this is an EMS response, right? And I've mentioned that EMS response times, and also, quite frankly, NYPD, but there are a lot more NYPD officers on foot. But EMS response times are going up, are higher than we've seen, and so we've seen also an increase in even Be Heard response times. And so Be Heard, because EDP calls for FDNY are a low priority, because again, they're prioritizing like heart attacks and things of that nature. It takes longer. The system is gonna deploy resources to those emergencies before they deploy them to a mental health emergency. And I live this every day, work in this field every day. We feel like mental health crises are emergencies and warrant an immediate response. in this big city, unfortunately, you know, the emergency response system doesn't necessarily see it that way. And so that's why, you know, under this administration and a lot of the work we do outside of Be Heard is try and figure out how we can get responses on the ground, you know, much quicker by creating new teams. Like, I don't know if you've had presentations from like Scout and Path, they're in the subway system, or other kind of NYPD co-response teams, because for NYPD, on the flip side, mental health calls are a high priority, which is why you'll see so many police cars responding to a mental health situation. Now, I don't necessarily agree with that either. I don't think that, you know, but so we have to figure out how to
Prioritize and balance.
get to a happy medium between the two of them, right? Because of this high prioritization on the NYPD side, that's why you get like, you know, a quicker, you'll see NYPD there before EMS, even though both should be responding. And you'll see kind of way more police cars than are probably needed. And so that's also something that, you know, that's part of the work that our office is doing too, is to kind of right size that for both parts of the system.
Thanks for that. I want to ask you, go on to the next slide. I think he has a question.
Yeah, this is exactly, is this what Mandami is talking about? Is this, he said he's going to have fewer police cars and more mental health, or is that completely irrelevant, what you're saying?
It's not irrelevant. He has talked about Be Heard. He has talked about expanding Be Heard, but he's also talked about
A lot of
creating kind of new teams, which I don't know if I'm supposed to talk about.
I'm trying to understand this whole issue, and I don't.
Yeah, but he does. He's talked about both. He's talked about Be Heard, expanding Be Heard, and he's talked about creating new kind of response options that do not include police, but that do include social workers and other mental health professionals. And as I said to you all, we are experiencing a mental health workforce crisis. So I think that we should, you know, kind of consider that when we think about kind of what to advocate for, and you know, how shifting away from police to another type of option looks like. Like, I think we have to really be broad in our thinking about what an appropriate response could be. Like, it doesn't necessarily have to be social workers all the time, right? And that's part of the work that we're doing on the workforce side, is training up other types of people, you know, professionals to respond to mental health.
Right, and there's something about what licensing is evolved and changing so that more people can do the work, is that right?
Yes, that's something that we've advocated for
we'll ask her what we should advocate
for some, for designated, for people to be designated to do involuntary transport removals to the hospital. We have tried to get legislation changed to allow for other mental health professionals, like licensed mental health counselors, who in practice, whose scope of practice is pretty much identical to licensed social workers. However, the legislation, the law doesn't recognize, you know, that profession or that license as one that can do involuntary removals.
Lakeisha, can I ask a question? Sorry, this is Ritu. I have 2 points that I wanted to make. Number one, Susanna, I don't know if you saw in Cranes, but Northwell Health is actually creating a school in order to train mental health professionals and healthcare workers.
Great.
That is one point that I think we should investigate and find out more about. But my question for Lakeisha is, our peer is that allowed in terms of Be Heard?
So we do have, so the role of peers and Be Heard currently, peers are staffed by H+H to do some follow-up for some Be Heard patients who consent to having follow-up in this way. But also all of the, and I don't know if I mentioned this, but every time a Be Heard team engages with someone, they offer follow-up services, and all of the follow-up services that the teams offer include peer support. So peers are not part of the 3-person team, the 3-person Be Heard team. And I think there's a very real question about, and part of the reason for that is because there has to be both a physical assessment done and a mental health assessment done. And peers, as part of their scope of practice, do not provide medical assessments. And so in rolling out the program, we had to prioritize, who can fit in this, who can be on this vehicle. And we have started with the EMTs and the social workers, the mental health professional. But we do value peers, and we think peers are incredibly important, which is why we make sure that all of our follow-up options have a level of peer support embedded in them. And we continue, H+H has a peer academy, right? And we're interested in kind of building up that pipeline of peers to be able to, appropriately work in as a crisis responder. But as a city, we want to work with.
Is advocating for licensure or for scope of practice to expand for LPCCs and LPCs, is that something we should be doing?
What are LPCCs?
Sorry,
I'm gonna actually
clinical. Sorry, I'm probably using the wrong verbiage. Clinical counselors instead of social workers.
Ritu, if you don't mind, I'm sorry, I'm going to interrupt. I'm just mindful of time. It's 8:10, and we have such a fat agenda today. I would like to ask LaQuisha, there's a much broader landscape that we are interested in. It involves also inpatient care and outpatient care, what happens, and we're not going to be able to cover all of that, even if you have all that information at your fingertips. I'm wondering if I can ask if you guys could come back at a different month, maybe January or something like that, and help us with that part, like what comes after this. We've been talking about crisis response. We talk about that larger landscape.
Sure.
And if we can table that, what I'd like to do is just ask you, what should we be advocating for? To Ritu's point and Ryder's point, there's going to be a new administration. We get to make budget requests, capital and expense. What do you think we should advocate for? What would help you? And by the way, would it be to your agency, or would it be, are you guys getting money from H+H?
For Be Heard, so for Be Heard, OCMH does not get any funding. The funding for Be Heard is from H+H and with the fire department. We are, as a mayoral office, we're more of a coordinating body. And so we don't actually we don't provide any direct services. We don't hire the social workers or anything. So it wouldn't necessarily be probably not funding for us, depending on what it is that you're.
What do you think a community board should advocate for, should ask for?
Well, so the largest gaps that I see in the mental health system, I think, is just really foundationally that the workforce. I think what we did as a city was say that we need to have a lot of mental health services and we need social workers to do them, and we paid social workers a lot of money to work in schools, and so on and so forth. And we've depleted our workforce to some degree. And so I think we have to right size that and invest in the workforce. And that also includes peer specialists, 1000%. That also includes peer specialists. We think that they are a valuable, important part of the workforce and can do a lot of the work that, some of the community boards, like, that I sit on the West Village Interagency Task Force, like some of that outreach work could be done by a peer, right? Like, and so I do think that investing in the workforce is really kind of where I would probably add.
You mentioned licensed health professionals. Is that could do the work of social workers? I think that was the term.
Licensed mental health counselors.
Which are okay.
So this is not like a funding thing though, but this is a policy advocacy area. Licensed mental health counselors are not, as they're not recognized to do a lot of the work that licensed social workers can do. And that goes back, part of that is because of Medicaid billing, right? Sometimes some Medicaid funded services don't allow you to bill both peer specialists and licensed mental health counselors. So like if you look at kind of Medicaid regulations and who can bill for what, that really kind of dictates how many of our mental health services are staffed, because that's where, we get funding from the federal, that's how we get funding from the federal government to pay for these services. So advocating to widen the range of professionals that can provide mental health services and also bill Medicaid for doing that work is I think a really good policy advocacy point.
I've interrupted everybody and tried to move this along, but I want to ask, who have I shut up and who would like to ask or say something? Move on.
Actually,
yeah, Emma, please.
Kind of going back to the beginning when you were talking about mobile crisis teams and that overnight gap, and also kind of that limitation around folks needing to have an address. Is that something that like sits in your office? Is that something that we could, I guess, what do you think about that from an advocacy lens? Is there something there that we could voice support for?
So I think the address piece of it is, I think it makes sense. If there were like unlimited teams, then that would, again, back to the unlimited resources, then yes. But the reality is that we have limited resources. We have, quite frankly, even amongst the mobile crisis teams that we do have, staffing is still a challenge. And so like even peers are required to be part of every mobile crisis team, but not every mobile crisis team has peers for, because of staffing, right? Different reasons. Somewhat related to funding though, right? If the teams were funded more adequately, could they potentially be more attractive to social workers and peers? So yes, I do think that potentially advocating for more funding for mobile crisis teams could be helpful. But again, it's like a little deeper than just like having the money to hire folks. It's really like the recruitment and finding people who social work, mental health professionals, or in the case of mobile crisis teams, they are interdisciplinary. But staffing, finding people who are interested in working on those teams. So advocacy, so help with recruiting for mental health professionals is something that that I think would be good for a community board to do. And we have a lot of, resources, like material and education opportunities that can help with that.
So if we wanted to ask for money for more Be Heard and for more pipeline stuff, and we're asking it of H+H, does that mean we're really asking it of the New York State Department of Health? Who are we asking it of?
So if it's specific to Be Heard, it would be H+H.
H+H, and they get their money from wherever they get their money, it's city and state.
Yeah, exactly, yes.
Okay, so we can advocate, okay, so. This is really great. You've given us a wealth of information, and I really thank you for your time. And actually, it's because of your time.
I'm sorry.
I don't want to wear out your welcome, because I really would love you to come back, because we have so many questions about the broader picture of what happens to people when they want to go into care.
Yeah.
So we'll try to have you come. We don't want to wear out our welcome.
No,
So,
yeah, so
I would say thank you very much, and then we're going to go on with the rest of our meeting, and thank you, Simone. I saw you nodding your head a lot, but better work than twice. Thank you.
Thank you.
Thank you for having us. Thank you for the really thoughtful questions.
Absolutely.
We got a million of them. All right, thank you guys, and everyone else can stay. We're going to go on with the next part of our agenda. Bye, guys.
Okay, take care.
Great.
Well done, Suzanne.
Very good questions, everybody. It's just like a whole Pandora's box. I mean, right? Okay, so I want to give out these things to all of you. We have
Thank you.
everyone who is joining online has this in an email that I sent. We have a visitor. Would you like a copy of what we're doing tonight? You pass one to him. Okay, so the first matter of business is we met with Bellevue. We had a meeting about show bands, which is an H+H program, and Bellevue in June, but we didn't have quorum. So we wrote a resolution, and we need to get a vote on it. So here you see the report stripped of the show bands part of that meeting. It's just the report on Bellevue with the resolution. I'll read it. Whereas, no, I won't read the whole thing. I'll read the what?
I think we all read it.
Okay, good. All right, good.
You asked us to.
Okay, I know, I'm so sorry. That's so sad.
No.
All right, so let's,
But can we-
I think I should say that therefore, just because for the part, right? So therefore be it resolved, Community Board 2 Manhattan, number 1, calls upon the New York State Department of Health to gather and share detailed metrics on the performance of Bellevue in delivering high quality service at every level of care, including diversion rates, times of boarders remaining in the ED before transfer to a bed, cycle time for patients, time required for cases that are not immediately life-threatening, but that can only be addressed by a trauma center such as Bellevue. And number 2, presses DOH to negotiate for greater investment in Bellevue by Mount Sinai Beth Israel as compensation for the void that its closure leaves, not only in its immediate district, but throughout Lower Manhattan. And 3, supports Bellevue's current requests for increased capital funding, especially for an additional CAT scanner and a single plane or biplane angiogram for treating victims of stroke. Those 2 are there because I don't really know the difference between them because I don't know about stroke care.
That sounds good.
Does anyone want to discuss this?
I would.
Sorry, I just have one question, and I wasn't here, and this is really not my area of expertise at all. The one thing that popped out at me was the pressing them to negotiate for greater investment as compensation, because I'm like, I just don't understand, does Mount Sinai have like just a ton of money that they could be giving to Bellevue? My understanding is that the hospital closed because of financial exigencies. So can we really just say like, soak them for more, tell them to give more money? Like maybe yes, but I was struck.
Yeah. Whether they will or not, and who actually has the lever to pressure MSBI to do that is a big question. They obviously have this big fat building that they're selling. They're also building an enormous building in East Harlem, but that's beside the point. We're not here to evaluate whether they're poor or not. They have offered, I think, 12 or $20 million to Bellevue. I think it's on here somewhere.
Yeah, 20.
20 to help them. And considering that it's an entire hospital that closes, we thought that that was a pittance. It doesn't, I mean, I don't care if we have it or not, because I really don't know what levers can be.
Right. I guess like I would propose, like, maybe we could say presses DOH to negotiate for greater investment in Bellevue, like period, or like comma,
Yeah.
perhaps from Mount Sinai, perhaps from government funding sources, perhaps from Mount Sinai. Like, we want them to have more money, but we don't know exactly what the most higher return is. So
What if
So
we would
just
have
put
said to
comma,
negotiate
including.
for greater investment in Bellevue as compensation for the void that MSBI's closure leaves? Does that work for you?
Yeah.
Without specifying who's doing the investment?
Yeah.
Okay.
So you don't want to say, as was just said, including by Mount Sinai, I mean, referencing it as a possibility.
Yeah.
Okay, including, by MSBI. So let me just read this again. Presses NYSDOH to negotiate for greater investment in Bellevue, including, perhaps including by MSBI? Is that how you'd like to-
Yeah.
Perhaps. Including by MSBI, right, no perhaps. As compensation for the void,
Sure.
Does that work for you?
Yeah.
Everyone okay with
And
that?
we were specific because the person who came
Yeah.
really late, he was really clear that that's what he needed.
Got it. I
For which one? For
number three.
yeah, for number 3, I mean, that all makes sense. Yeah.
Do we want to vote on this? Okay, all in favor?
Aye.
Anyone opposed? No, okay. No opposed. Wait, so, how many? 1, 2, 3, 4, 5, 6, 7.
And then
I don't.
And I think I count, Susanna, because
You
I'm out
count
of
for a
town.
vote? Okay, good. Zach unfortunately does not count.
But he votes
He
yes.
votes yes. Thank you.
Okay.
Thank you for your moral support, Zach. Okay, good. So now we're going to go on to another resolution. This one is opposing the use of masks by ICE agents. And
Yes.
advanced by Arturo. And Arturo, do you want to read the therefores, and then we can see if there's any discussion?
Yeah, definitely. So thanks everybody for taking the time to read through this. The therefores for this resolution are: Community Board of Manhattan opposes the use of masks in law enforcement and finds concerns about doxing to be secondary to the value of transparency and accountability as essential requirements for public trust in law enforcement, and supports efforts by elected officials and advocacy organizations to end courthouse arrests, bar practices that mask officers' identity, and then probably should do a little bit of grammar there, affirming that courthouse arrests undermine public confidence in the justice system.
Wait, so you want to change?
No, I think it works.
Right?
Supports and affirms.
Yeah, supports and affirms.
Okay.
Supports advocacy by the judge to end and to bar,
Okay, got it.
and affirms that.
I have a completely ridiculous question.
Yes.
Would anybody on the committee mind if I sent that resolution to Mira Nair? That is Mamdani's mother.
I mean, it's a public document. You can send it to whoever you want.
Thank you.
Maybe after the board passes it.
Maybe
Of course,
when
of course, of course.
passes it. It's a public document.
Okay, thank you.
Question. There is something called the MELT Act out there.
Yes.
Why do we not refer
We-
to that?
I think we do as one of the actions.
We do as a
One of
whereas.
the whereases.
Oh, okay.
I think just continuing that discussion, I know we had a bit of a back and forth on this. Like, I still would really think that this would be a stronger resolution if we explicitly called out the MELT Act. I did share the bill text. I think would be a stronger way to communicate our support for state legislators, as well as like for specific actions that we want, our electeds to take.
So why didn't we write it?
There's just one line. This
Yeah.
is.
I guess I I mean, I think this is great. I really appreciate that this resolution exists. I think it's really relevant for the committee, and I think it's timely, and I think it's on the money. I actually prefer the current framing and wording because I think it allows more capaciousness to demonstrate that we support these current things that are right now being advanced by elected officials and advocacy groups, but we're not limited to those things. We support all of the elected official and advocacy efforts to address this, which is including but not necessarily limited to the things in whereas number 7. So I would support keeping it as is, but that's my thought.
We could mirror what we just did and sort of, keep it
Yeah.
broad that we.
Including
The
Melt Act,
for
yeah.
sure. And
Yeah,
just
that works.
adding, saying, including the Melt Act.
So where would that supports efforts by organizations,
Yeah.
including the Melt Act?
Yeah,
Yeah.
No,
affirms,
that-
yeah. Just so that.
Yeah. yeah.
Any other discussion?
I think this is great. I was excited to.
Do you want to vote on it? All
Could,
those,
could I make a comment?
no, yes, of course you can.
I also agree that this is very important, but I have some concerns about who this is intending to influence. Because I definitely hear the point on the Melt Act, which is a state legislation, and I think that could be a good anchor for us for this resolution. But otherwise, this feels a little bit more like a federal policy that we're talking to, and we don't really have much influence to our federal legislators.
No, but it's not though. You look at what the state of California is doing with respect to this, and it would be on the same basis.
Yep.
So I totally hear that. I guess that brings up the question of like, should we actually make this much more specific to state action, to legislation that's being considered, rather than having something that, to me, I think the resolutions in general are a little too broad, I think, for our general scope of the community.
So do you just
I would
want,
respond and say, I'm not an expert on the Melt Act, and I don't really want to become an expert on it. If I'm voting for this, I'm voting for the principle behind it. I could see sending this to our elected officials, and they can interpret it as they want to. I don't feel I need to be specific.
Hey there. Will you say not say including the Melt Act?
No, you can say including the Melt Act, but not, I don't know, Zach is advocating for something more specific, and I prefer not to be too specific.
is he
I don't-
saying supports efforts by state and city officials? Is that
I don't know.
what you want?
I
think that's great.
Yeah, I think focusing it on the state and city officials would, to me, I think solve some of that issue, right? Just so it doesn't seem like it's we're trying to influence federal policy.
Okay, so now they're. I'm sorry.
I really disagree with that, because our federal elected officials are also our representatives and are like implicated in the advocacy for the community district. And like, if our congressman wants to also be trying to use the power he has to end masked apprehensions, why wouldn't we be saying we support his efforts too? Even though it's a
All right, so let's leave it at elected officials.
Yeah.
And we'll send it to all the elected officials.
Yeah.
So it now reads.
Hello. I have something. Hello?
Valerie.
It's Valerie. Hi. So one thing, who, you can of course CC all of the electeds, but who is the one person this is being addressed to specifically? That's my one question. And then my second question is, who has read the Melt Act here? Is the text of the Melt Act been read by the committee? Does the text of the Melt Act exist?
Yes, Arturo sent it to us.
Yeah, Valerie, I shared the bill text with the committee earlier today. It's online as well. Happily can share it with you.
So my question is, who has read it, and have you read it to comment on it? And who is this letter being addressed to? Who is the resolution going to? The name and title.
Yes.
Really easy question.
We can definitely anchor it with our state.
So I want the name, I want one person. I want one, you can CC all the electeds, but
He's not our person.
Yeah, so I think Glick and
who, so let me finish,
Yes, I
Arturo.
just said-
let me finish. So let me
So it can be directed
could-
to our mayor and our governor. It's very
if-
straightforward.
If you could let me finish, I'm asking, who is the name in the title that this is going to? It is not clear to me. So I'm just asking a very simple question.
Yes,
We can-
Arturo's gonna answer that.
We can anchor it and send it to Assembly Member Glick and Senator Hoylman Siegel.
I have a question for Valerie. It's not my understanding that we usually designate a specific recipient for a resolution.
We do.
I actually was told differently. Somebody was told me that we don't write letters, we write resolutions.
Right.
So the resolution is addressed to someone. It has a name block and a title. I'm happy to share examples with
And
all
it
of
has to be
you. So
one person.
my name and signature, my name are on that. So I'm pretty well versed. I appreciate the challenge.
No, no challenge was the question.
So
So if the answer, Valerie, is Glick and Hoylman Siegel, are you comfortable with that?
oh, it's not about comfortable. I'm just asking. The question. It's not clear. It just seemed unfocused. Thank
Okay,
you so much.
Great, thank you, Valerie. We're gonna take a vote on this. All in favor?
Aye.
Any opposed?
But I'm looking for.
No.
Two also.
Rita, are you in favor? Yes.
I'm in favor. I'm wholeheartedly in favor.
Okay. Great, so that passes. I would like to say something about this resolution. And I think it's gonna be an unpopular opinion, but I'm going to put it. There's a lot going on in the world that is painful to me personally, and there's a lot of wrongdoing in my humble opinion. And we could become a body that takes a position on all of those things. I don't think that that's where we are strongest. I think that our real job is what we do tonight, the budget requests. Our big job is to be the people who care about the garbage bins, not what's happening in the world. Now, I think that there are times when it's inevitable for us to take a position. We took a position on Stonewall because that is in our district and it's about our history. I'm willing to take a position on this because we do have a federal courthouse, but I don't particularly like the practice of us taking political positions that are strong. They are advocating, their advocacy, we're on the right side of the issue, but I don't see that as our job. I think there are lots of other places where that job is done with your elected officials, with advocacy organizations, but I don't ultimately see that as the role of the community board. So that's my position. So I'm okay with all of this, but I would like not to see a stream of work and resolutions on positions that are not really directly affecting our neighborhood. So if I think that's the point that.
Because I would say that this one does directly affect our neighborhood.
I agree with you. I myself am a naturalized citizen. I became naturalized 50 years ago. I am concerned about walking down the street and being apprehended by ICE for no other reason than my skin color and being put in detention where I don't know who would actually come and look for me because I'm a single person. And so while I may agree with your overall sentiment, I do believe that this is not a tertiary issue. This is at the heart of what we do, and we have influence. Even if it's just 1 centimeter or 1/4 of an inch, we have influence and we should exert it in the moral authority that we have. That's my 2 cents. Thanks.
So this is fine. I would just like, as we go forward, as long as I'm chair, that before we bring topics to us, let's think very carefully about who exactly is this going to? What exactly do we think our resolution could affect, EFFECT? And how does it contribute to our overall scope of work, which is to our overall mission, which is to advocate for our community district with the city and state's budget. Just putting it out there.
And then if I could just briefly
Yeah.
add, I mean, two things is like, one, Susanna, I'd love for all committee members to feel like if we have topics that we want to bring to the committee that, that's welcome, right?
Yeah.
That I don't think we should create rules about these type of things are allowed and these type of things are not allowed to be discussed. Whether we vote on it and make it a resolution, oh, definitely. But I think we should definitely have the conversation in committee. The second thing I would say is that we did pass a resolution, Community Board 2, the Social Services Committee in 2017 in support of the Liberty Act. So there is precedent in this committee and at the community board for taking action in response or passing resolutions in support or against, state legislation. So I think all of those things have a historical precedent in this committee and the community board.
Look, different people are going to take different tacks. As I say, if we had a position on the Stonewall Monument, which I think is very relevant to our community district and to who we are. But I would like, while I'm chair, I don't want to see a lot of, I don't want to see a lot of national.
So you're predicting that there might be, and you're already, it sounds like
Yeah.
obedience in advance, which.
It's not a question of obedience. It's just a question of what I think are the
I know,
guidelines.
but we're not even there yet.
Okay, I'm putting it forth because there's a lot going on in the world and we could
Okay, well,
choose to take positions on a lot of things and we could find marginal ways in which they affect us. But when it comes down to it, our job is to contribute to the budget.
Yes. Well,
That's our job.
when it comes up, something in the future.
Yeah, no, I'm
hypothetically,
just saying as a
things that have-
guideline. I'm not saying anything about this. I'm just saying as a guideline. going forward.
I know,
That's my-
we understand that, but I'm just telling you, it's premature.
Okay, well. All right, anything else about that?
There's something I want to discuss. Done.
All right, okay, so now we've done all that, so now we've got to go into the budget request. All right, so what do we have here? We have a ton of stuff. All right, I'm just gonna guide you through it. In addition to everything I've given you, what we don't have is that the public library has some requests
Oh.
that we may want to consider including in our list. And I did not distribute this, but you're welcome to look at those. I have here just to refresh our memory, all the meetings that we've had. In case any of this, this is really more about the scope for next year. And you can glance at this, I'll show you where it is.
Yeah, no, I saw
This is, yeah, so, unfortunately, it starts in the back, goes to the forward. I personally went through this and looked at things that I thought might be, but this is not an end to discussion, it's just a springboard for discussion. So you'll see a page. Well, first of all, I'll go through what we requested the last time and what this agency's told us, okay? We asked for IMT. They said that they support it. This is DOHMH, but they can't accommodate it, so please resubmit the request. Okay, so I think we should include that. Social services, they didn't like bridging the gap. They asked us to remove the request. They're not contracted by the city. Department for the Aging, we asked for money for the upkeep of Branch Houses building. They asked us to resubmit the request. Paul's Place, we asked for clothing and toiletries and they said they support it and they can accommodate it, so remove the request.
How do we know if they have accommodated it?
No idea.
Okay, I was scanning that, I was like, okay, I guess we exclude that.
We should ask people.
I guess that's.
Ask Paul's Place.
Okay.
But yeah, no, I don't know.
I was like, that's nice.
I know.
What happened?
Does that mean exactly?
Okay.
And then they also asked us to resubmit the request to support the DOOR's food and nutrition services. And this was for the Department of Youth and Community Development. So we could resubmit that request. So that's 3. So now here are some other possibilities. I'll just raise them so that you have to. We might want to ask for show vans. That was the subject of our meeting in June, and those are mobile health vans, not mental health vans, health vans.
Yep.
We might want to request be heard.
Mhm.
A unit somewhere in Manhattan would be nice. We might want to request again IMT, which we've been encouraged to resubmit.
Yeah.
And
On Be Heard, we haven't passed a resolution yet.
no, we have not, you're right, but we have to do
We-
this. We don't have.
We
to
are not
have a
usually
resolution.
limited by that.
Yeah, we don't have to have a resolution to make a budget request. But it's why I was glad to get them in before we. And then these two others, there's the maintenance of Greenwich House, I'm sorry. Piece of paper here, sorry, Janet.
Like after the.
I feel like we're in synagogue. So this, show vans, it's this page, yeah. Possible meeting ideas and budget requests. And then on this is also the business for Bellevue. So is there anything else?
Seems pretty comprehensive.
Yeah.
One thing that stuck out to
Yeah.
me from the presentation was that it sounds like we're just in a undersupply of professionals that can serve the community. So it sounds like we need a big investment in essentially like a marketing and recruitment program to bring people from other places here.
And also education.
Yeah.
I mean, remember, I don't know if you remember this, but the Door told us that they started a scholarship program with NYU to get their staff to become social workers.
And then you just said you saw the Cranes article.
Yeah.
But we also, we're getting ahead of ourselves a little in the resolution. Well, we want money for, workforce development.
Right.
Okay, so we'll deal with the resolution.
I think,
later.
sorry, I mean, often we hear about issues related to staffing. We've heard it from the CUCS or, the street outreach teams about they have 50% vacancies and it's a combination of insufficient salaries, lack of talent, the kind of process, onerous
I have
process.
to say that I wholeheartedly disagree with you. It is not about a lack of talent. It is not, it is the fact that we have a demographic cliff that we are all going through right now. There are not enough people to replace the older generations that have typically staffed this sector. And it's not about money necessarily. It is about attracting people into this educational channel and supporting them throughout that. And that's what we don't have. We have too few younger people. The average age of an internal medicine physician in the state of New York is over 57 years old. We don't have enough people that are qualified to do these jobs.
Yeah, so I think that's exactly what I was saying. There's insufficient talent pipeline. And so I think I just think and so that's like on the supply side of the talent. Also, there are problems on the demand side of pulling people in, both in terms of capacity and I just think it's a very knotty issue that the next administration is going to have to really address in terms of getting the right getting people and addressing the problems that Rita's bringing up. And I just don't know that there's a request we can make that neatly
What if we were to ask
scratches at it.
H+H, or the New York State Department of Health to pay for a scholarship program for training of social workers? I don't know.
Or invest in workforce.
Or the other idea to expand that is to increase the licensure acceptability
I feel like
for counselors.
So it feels like this is just such a big thing that
We don't know anything about it. So it's too soon to request. Is that what you're thinking?
But there
Well,
are
we could-
programs that, like, it would be interesting to talk to the door and learn more about this scholarship program.
okay.
And I just mentioned H&H has a loan repayment program, like, what does that look like? Who gets it? Can we talk to a social work school at NYU and understand like how they're funneling folks? Like, I think this is a
Yeah.
really interesting discussion. I'm happy to do a little bit of preliminary research on who we might ask about this stuff.
I think,
But I don't know that we're prepared right
I
now.
would be a little sad to just like not say anything
I
about
know,
it, right?
I know.
Even though I get that it's complex and there are multiple layers of pipeline and layers, education, development, like, let's just say nothing also feels like not right.
are we doing a resolution about Be Heard?
I really have no idea if we're doing a resolution.
Because that feels like a sensible place to say that we've observed this problem. Like we heard from them that it's an issue and we've heard it from other people. And it's something where we want to see.
First of all, should we do a resolution on Be Heard?
Yeah.
Resolution on what?
On Be Heard. Should we do a resolution on Be Heard?
You know,
We don't have to.
I mean,
Yeah,
to
we
speak to
can.
the things that whether or not, we have to address, I mean, the big thing was obviously, and it's very complicated, because it involves Medicaid and Medicaid, covering licensed mental health, providers, but to chip away at the problem is they really have to change the licensing requirements for these teams.
It was really an instructive conversation.
Yeah.
Because she raised a policy question that we can advocate for over the year and investigate, and also a financial question, which is the workforce development.
So, I mean, I think we could do a whereas, therefore be resolved that the city should investigate changing the requirement, the licensing requirements of people on these teams.
Well, so
But
that's
very complicated.
I would think that I would feel more comfortable having a resolution about Be Heard, asking for one in Manhattan, and in the whereas. Address, citing these questions with policy, and then in the course of the year, we might find a way to actually directly address the question of policy, the policy change. Does that make any sense? I don't feel like we've had a full fleshing out of.
Except she was so clear about that, about peer specialists, and she specifically said that licensed mental health counselors are as good as social workers.
I've heard other people say that.
I think there's literature. I think they are tied to their own codes. Like, it would be nice to be able to point
Know more about it.
specifically to areas as opposed to saying we want licenses to be more flexible to fulfill the task broadly. Like, I agree with you. It's a clear problem she defined. I think it would be cool to be able to point more specifically.
Yeah.
To areas. I think that's really should be.
And I think those mental health counselors actually get more training, because I think licensed social workers have to do 2,000 hours, and these mental health counselors actually do 3,000 hours under supervision. Just FYI.
Do we need to know more about that, really? I mean, she was pretty specific.
Well, I mean, I think it would be helpful, because I think it would be helpful to know where they serve, where they could be serving, where the lack of them is a problem.
So we could have a future resolution that talks about the use of these particular professionals in other capacities other than just they could be useful with, Be Heard. We could be using them here, there, elsewhere. So we could come up with
we could have the agenda topic. The agenda topic could be the policy about licensing. And then people would know that that's the topic that we're gonna have a resolution about. It's a policy of choice, and we could decide who to bring in that has experience with this and who would very much like to be able to have a change in that. It might be someone from Be Heard, but it might be someone
in the hospitals too. We don't know.
Yeah, exactly. But then instead of saying it would be great if LMHCs could serve on a Be Heard team, we could say it would be great if LMHCs could serve in parallel for like X different.
Yeah,
you know
exactly.
what I mean?
Yeah.
Like
order of the
we
logic.
should definitely mention in the Be Heard resolution. I think I agree with you. But I don't know.
So the Be Heard resolution, I'm hearing an interest in having a resolution about Be Heard. One is about assigning and then mentioning licensing policies. And in the whereases. I think the therefore would be getting one. But the whereases would also cite the limitations due to lack of workforce development. Policy, yeah?
Yeah.
Does anyone want to write this?
I could take a stab at it if you want to work on it together.
Yeah.
Because you said you were going to look into the details.
Yeah,
I can
happy to
maybe
work.
talk about workforce
Yeah,
development a little bit.
We can take a whack.
Okay, that sounds great.
Well, what's a?
I'm not.
But it's, we're not ready.
Okay. No, I'm the reason I raise this is because Valerie has not yet determined a succession plan for the committees, but it was mentioned like people can start writing resolutions, which is a really good muscle to flex. And so the timeline is our full board is October 23rd.
Okay.
And I can help you. And if you get stuck, don't panic.
Don't panic.
You know what I'm saying? Like I could do it if you want me to do it, but I also think it would be really great to familiarize yourself with writing a resolution.
I can also help.
Okay. All right, so let's do Emma and Arturo with anyone else for backup.
Yeah.
Okay, that's great.
Yeah, as long as it's not due next week. Yeah.
Right.
I should also mention that we will not be having a meeting in November or December. And there's a limitation on this committee because of November is Thanksgiving, December is Christmas and New Year's, and of course we have August. So really we only meet,
9 times.
and 8-9 times, and then maybe one gets canceled. So we really we don't have that much time to cover so many topics. So anyway, but
We're doing great today.
you're doing great. I know,
So
it's
far.
late. So
Something else go wrong.
back to requests. Show vans, Be Heard, IMT, Greenwich House Building, the Doors Food Service Program, funds for Bellevue, and is there anything else? And do you want to tell me what your top 3 are of this? I think we should also include some library things, whatever they are.
Could I jump in with
Yes.
something?
Yes.
Something that Bellevue talked about, and I'm curious if we feel like we're comfortable enough in it, but they talked a lot about transitional housing. And that's also come up with a bunch of the nonprofit partners who came in, and would be curious if there was appetite to just, in general, talk about, city budget allocations to more transitional housing.
Yeah.
Where does that go?
It goes to DHS, I guess.
No, but I mean, is that
No, this would be part of the request, our budget.
Of the budget request,
Sorry,
yeah.
we're jumping around topics.
Yes, sorry. I didn't want us to close on the topics.
What is transitional housing? It's shelters?
It was basically, so the context that came up in Bellevue, it was that a lot of people, they have basically in the hospital and they can't get them out, which is like sapping state resources, and they want to put them in transitional housing, which is some version of potentially some light mental health care, or addiction substance care, but not something like a full-time rehab or a psych bed.
In other words, is it a buzzword that someone else will understand? Because
And Bellevue referenced some support, some transitional housing that exists somewhere that they said that was very
I'm looking
effective.
at this.
Because there's some people who get discharged from the hospital and they don't have anywhere to go.
Oh, is that in our res-
Were you at that meeting?
I was,
Transitional housing appears to be a commonly used term.
okay.
Talking about.
I think
It's
it's a
just housing with social services.
that is not meant to be permanent supportive housing.
Correct,
Okay.
that's right.
Subset of, what did you say? is
Supportive housing.
Supportive housing, okay.
Yes.
Got
You're
it.
open to
Okay,
additional reference.
but not long-term. Okay.
Yeah.
Permanent supportive housing.
And what agency would that go to, do you think? Would that go to DHS? No, would that go to
Department of
DOH&H?
feel like it was
I feel like
the
it does.
DOH though, because
I actually do think it would be Department of Health. Does DHS also cover all social services?
What? Does DOH, I just don't know who builds housing.
I think it would be H.
Like,
yes, you know.
For social services, Department of Social Services?
Yeah, I think actually maybe Department of Social Services.
yeah, we could try that.
Yeah, because they have a whole site on supportive and affordable housing services.
Yeah, but they're more like connecting, they're not building, like they're like a connector agency. That was a really bad description.
No.
That's what it is.
Well, we just need to identify, we need to identify an agency for each of our requests.
Yeah.
Which we have so far, but transitional housing, I'm not entirely clear. But maybe I can find that out.
I'm gonna ask ChatGPT.
She knows all things.
This might have come up already,
Yeah,
and I might have just zoned out when we were looking at the responses we got, and they rejected the Bridging the Gap funding and said they do not support it, and said to follow up for more. Do we know what the deal
I'm
is
gonna
there?
guess that it's because they don't have a contract with Bridging the Gap, so why, they're not gonna give money to some not-for-profit. That would be my guess.
I see.
New York City Health and Hospitals.
Okay, so it's an H&H. I just don't really think of,
These efforts are coordinated under New York City Health and Hospitals Housing for Health Initiative.
okay. So we'll ask for H&H. I never think of H&H as being an agency.
New York
It's not,
City's
it's an
Bridge to
authority.
Home facility opened in September
Right.
by H&H, provides transitional housing specifically for patients with serious mental
Where do they
illness
get their money from?
who are ready to be discharged for lack of stable place to live.
But it's on the city. I'll see if I can find that out. Oh, Mark, here's a question for you.
Okay.
If we wanted to make a request for transitional housing, which is like a subset of supportive housing, but not long-term, and we know that H&H does that, I mean, can we make budget requests of H&H?
So
There were
your
40,
budget comments need to be to city agencies,
City agencies.
not state, not federal. Although obviously with the looming federal threatened cuts, that, you know, that's a topic of every single budget consultation we're doing with OMB, for example. Anyway, that said, your comment on the budget will be a comment on the city budget.
Right, okay.
I
So
confess,
you gotta presume that the city gives money to H&H.
And then it goes on, it says H&H works closely with agencies like HPD and DSS to create and utilize supportive and affordable housing options.
Right. H&H is not one of the agencies
It'd
that
probably
ever
HPD
comes
then.
to, and
Yeah.
It's
I
not an
think it might-
agency, it's an authority,
it's right, it's a
it's like NYCHA,
public benefit corporation, I think, yeah, okay.
it's like NYCHA. So would we make a request of DSS, do you think?
You certainly could make a request of DSS.
Or HPD.
It would be, I don't know the answer to the question, where do they get their funding directly from? Is it a line item in
Yeah,
the federal budget? I could find out, but
no.
It's like all that stuff is HPD.
Do you think that that's what transitional housing is, or is it Medicaid?
I think it's a combination of HPD for the like building of the housing, and I think it's an HRA thing under DSS
Right.
for like the services
Right,
related
like
to housing.
You
a
gotta
person
do
would
that.
get the services through HSS, but HSS is
DSS.
not like, sorry, DSS.
I got it, but they're not building.
HRA, like they're more like the
Like
facilitator.
Right, so
Are we-
capital would be building the building, like Ryder
Which would
said.
be
Capital would be
HPD.
building the building,
Yeah.
expense would be putting
Got it.
people in it and making it work.
Got it. Now, we are not specifically asking for transitional housing to be built in CD2.
Why not?
Why not?
We should have local transitional housing.
But we don't have to.
I think I would say
I don't
just in
think we're asking
general, transitional housing would be good because the city will move people around kind of as needed. It just seems like a large area of underinvestment.
Well, let's ask for it, and we don't have to specify in CD2 and give it to GSS and HPD, and it will just signal that we see a need for it, and they will say, thank you very much, but see you next year.
Awesome, thank you.
What do you think, Mr. Ryder? I see your wheels.
No, I mean, I just think like if we're opening the aperture to just be like, I mean, maybe this is related to your earlier, but like, what general things would we like the city to do?
Right.
Outside, not relevant to this community district specifically, and like, my hobby horse is I would love to see more safe havens, and like, I'd love to see them in CB2, but I don't know that it would be sensible as a capital request to be like, build another drop-in center, build another pulse, like.
Also because they have an open RFP.
Right.
For shelters. Like if anyone wants to open a shelter, they are ready to have a shelter be open. It's not a lack of funding. It's a lack of.
It feels kind of along the lines of the workforce development stuff. Like there are a lot of things we would love the city to be investing in. We've commented over the year about immigration rights, education, and workforce development. And so it feels a little bit like I agree in principle with
it's not specific to CB2.
Right. Yes.
And we may water down our other requests, like why just pump it?
But we can put it in there and let's give it a try. We'll put it in there, but let's prioritize. Also, where's the library stuff? I think you have the stuff from the library.
I don't think we ever.
Okay, yeah. All right, I'm gonna put in, no, there was something. That one? Yeah.
I'll give you one page.
Yeah. Are you guys okay if we put these capital requests in for the library?
Yeah, I didn't see these.
I would like to see the Hudson Park Library completely renovated, but that's.
What's that?
Is that down in South?
No, it's next door to Tony Depp.
So
And it's a dilapidated building, sweet, very sweet, old village, like dilapidated.
If they're specifically asking us for these specific things, I think we might as well.
Heating pool. Yeah. I think two lives. Yeah.
Is this us or is this an education committee thing?
I think that we
let's
have
do
had
it.
a meeting before about libraries. And I see them more as a social service.
Yeah, I know. That was not a leading question.
On the budget for education, so I think we can say yes.
Okay, so we'll put this in as well. And if I was gonna, let's go around the room. If I was gonna prioritize 3 things, I would prioritize IMT, Be Heard, and funds for Bellevue.
Can I interrupt for 1 quick second on the priority because it changed this year?
Yes.
Okay, so no longer are there's the top 3 needs of the district. Right, and that's a communal decision by exec, I'm pretty sure. But then it used to be that you prioritized your list and then you merge that with parks and everybody else, no more. So what I'm told, we haven't done it yet, of course, but what I'm told is that we prioritize by agency.
By agency, okay.
Not even by.
Not even by committee or by.
You saw those cockamamie subgroups that they put together in the things that I circulated. So I'm told that like if you had HRA requests, you would have 1, 2, 3, 4, 5 for HRA. You'd have another 1, 2, 3, 4, 5 for, well, TSS is part of HRA. So, but if you had.
We have DOHMH, okay? We have 3 requests here for DOHMH.
So you prioritize them in whatever order you wish.
We have 3 of them, so we'll just we'll put them in.
But in order, right?
Right, and we have 1 for DIFTA.
Yep.
1 for youth and community development.
Okay.
Bellevue, I'm gonna put it under Department of Health. I'm gonna presume that the Department of Health funds Bellevue somehow.
Well, yes, it's probably from them. We can find out.
Siri, does New York Health and Hospitals receive funding from the city of New York?
It's a public benefit corporation, so it probably gets an awful lot of money from Medicare and Medicaid.
It does.
It does, but like,
to get really hit hard by reduced funding from that.
It does. It receives significant funding from the city of New York.
I would imagine that in addition to their insurance reimbursements, that they get specific grants from both the city and the state.
Yeah, just like NYCHA does.
Yeah, 85%.
Okay, good. So we're definitely sending this to the New York City Department of Health.
Okay.
And transitional housing, we're going to send it to HPD and DSS. So we only really
kind of pick one, I think.
Pick one. We'll do DSS. DSS.
Okay, so we don't have to.
Thank you,
So we only have one for the Department of Health, which is Bellevue, so that's.
Yes, we
okay.
have 3 for DOHMH, show vans, Be Heard, and IMT. What do you like best?
I really like Be Heard.
Yeah, let's do, yeah. How do you all feel? Be Heard, number
Yeah.
1, IMT, number 2, show vans, number 3?
Yeah.
Okay, good. All right, that's good. We're done. Now,
Good chance.
and the libraries. Oh, the libraries, that's a different agency, and I don't even know what agency it is, but we'll ask Mark and he'll tell us.
NYPL is an agency.
Oh, it is? Oh, that's so nice to know. Okay.
What do you say?
NYPL is a city agency,
As is Queens and,
Brooklyn.
Yeah.
Okay, excellent. So we have done our work unless there's anything else we want to add, change, or anything. Okay, good. Now, I just want to go over some possible meetings for the coming
yeah.
year. And I promise we'll leave in the next 20 minutes. SHAP, the Street Homeless Advocacy Project, they are a not-for-profit on their own. They do outreach and they come to every village interagency task force meeting. And we would love to hear more about what they do. They do a lot of work in Washington Square Park.
Okay, sure, yes.
They're gonna come at the end of October, but they don't have to be the only thing on our agenda.
I guess my hesitancy is like, I haven't heard of them, which doesn't mean anything, but if
you're
we're
not a-
inviting nonprofit service providers to street homeless people in the district, there might be 1 or 2 other
That's true.
groups that could come alongside, and it could be a more,
Okay, so let's see if we have any other ones. We have many other times met with the Manhattan Outreach Consortium.
Yeah.
But that's different.
I think that's different. I would say like if we're, because we often talk to government
Yeah.
nexus operations, but if we're looking to like,
Yeah, let me ask actually the
yeah,
women
I can
from
ask
SHAP.
around too, yeah.
I'll ask SHAP who else might want to be at that meeting. Couple of things that you're not as aware of. There's something called the Q teams that the NYPD is doing, and Jessica Tish has started and all this kind of stuff. And there's a lot of talk about it at the ITF. And I'd like to know more about it. You guys,
What is it? Or-
they're specifically address quality of life.
Yeah, so they're like designated NYPD teams where the officers are all on quality of life specific, because quality of life specific beat. And they existed in some parts of the city, and Tish has been rolling them out everywhere.
This is
And
an
apparently
Adams
like
Fish pilot.
places.
Does this mean they're going to arrest every member of SAPO?
What is SAPO?
Street
Oh,
activity.
yeah, that'd be so good.
I think,
It says they crack down on illegal vehicles,
Yeah.
encampments, noise complaints, illegal parking, and handling of outdoor drug use.
Yeah, so
I don't know how they do any of those
I
things,
think-
but that's the.
I think if,
They haven't
if,
come to the village yet.
if this is a 2026 thing, I think depending on the result of the mayoral election and who ends up being the police commissioner, like whether this is still a relevant thing might change totally between now and February.
fair enough. I do think, so I can cross that.
Or just like, let's revisit
Yeah,
in December.
Okay.
Or like, you know,
Is there any overlap with,
Yes.
sounds different, but maybe overlapping with the village interagency task force, like would those things?
I think there's more overlap with this quality of life concerns near Broadway and Houston.
Okay.
So that was the meeting we were gonna have in July that was canceled.
Oh,
I'll just give you the origin. There was a New York Post article, okay, Greenwich House was due to come in at the end of July to talk about additional services that they've added to their methadone clinic, which has a different word. It's a wellness center or something like that. And right before they were coming in, there was an article in the Post about rampant drug use on the streets right around their location. And of course, the Post says that, they allowed it and all this kind of stuff. And at that time, I got a handful of emails from people in the neighborhood sending me photographs and stuff of terrible drug use. So I thought we should do, if we're gonna have Greenwich House come in, lest it be, people throwing tomatoes at them, let's talk more broadly about the project. We put the kibosh on it because Valerie said there was informing that there was a broader city initiative going on to address quality of life in that area. I've done some research and it's part of the Q teams. It actually, I think, regards all the different precincts because there's a juncture of precincts there. So I'm going to research that a little bit more. And what I would love to do is have a meeting where we meet with Greenwich House and with these people so that we have, does that make sense to you guys?
Just real quickly, I'll hop in. It is not part of the Q teams, just to clear that up.
Oh, okay.
Thank you.
Right, fine, thank you. So, okay, then at some point we might get an update on development of the shelter at West 11th Street. Bailey House and Housing Works, which is, they own a building on Christopher Street. That's in the process of being renovated, but I check with them every 6 months and nothing has happened there yet. So that may come up. The Greenwich House thing is going to be related to this quality of life thing. So let's see. Process and resources, where are the gaps? Oh, I think we should have I'm talking here, but you guys jump in. No, I think we should have another meeting with LaQuisha and that team. No, okay, we've talked about their responses. So what happens afterwards, right? Like, where are their gaps?
I think she already, sounds really informed about just like the larger perspective view in terms of the data, like where are people ending up? Like what is not being addressed? Because I think that's exactly what, like, we'd love to know.
Yeah,
how to find it.
And I can tell you, because I attend the VITF meetings, that one of the things that there's always a question of, so you picked him up and you brought him to the hospital and then where did he go? And then did he have a place to go? And then, but then no one follows up. So there is a question of what the gaps are farther away from the incident. And so that could be a meeting that we have with LaQuisha.
That ties back to our.
Well, is that change depending on the next police commissioner, the next health people? I mean, how fluid is all the city services?
Well, my understanding, and I am an ignorant person, is that when it comes to the complex landscape of what happens to people who are mentally ill, homeless, and substance users, it's a very complicated landscape. Who ushers them to treatment? What if they don't want to get treatment? What if they want to get treatment? Is there a place that they can stay for 30 days, for 60 days, for 90 days, for 6 months? Who's paying for it? Does it have to be upstate? Is it in the city? I don't know any of that. And we see all these people in our streets, and there's always this constant question of like, well, what can we do for these people?
Right.
Can I also just advocate for others that use Be Heard and do use 988? It's not always the homeless person or the drug addict on the street. It is most often people who are suffering from like acute depression or acute anxiety, or they may have other mental health conditions where Be Heard can be helpful. And so I just don't always want to like react to like, oh, that person must be a drug addict or homeless.
Right.
Yeah,
Sure. Yeah, like she even said that, like the majority of these cases, she said, can be resolved with a phone call and services.
Yeah, right.
She also said there are people who care for them and love them already.
Yes.
So that's interesting.
Yeah.
In terms of just the ecosystem of different providers, and so like there's also the subway outreach ecosystem. So there's the scout teams, which are like an MTA thing, and then the PATH teams, which I think are a city thing. If they're both acronyms.
And then there's MOC.
Right. So like I don't know, maybe LaQuisha and like the mayor's office is the right kind of, I can't believe I'm using a sports like a quarterback to like describe to describe all of it.
They have a handle on it.
But maybe we also want to bring folks in from those. But I do think the likely change in mayoral administration is gonna just change all of this, in which case like the meeting to have would be like about how the new Department of Community Safety is going to impact Community District 2, like
Yeah, but in
So-
fairness, I mean, we're not gonna have a new administration until January.
Yeah.
And, we have one more meeting until then, and
Yeah,
then
yeah.
we have, it's not gonna be the first thing that happens.
But it's not that far away.
Finally understand what's going on, and then the whole thing changes.
If we only have
What is it?
October before.
Well, no, I would just say that, we also had a previous administration,
Totally,
right
yeah.
before Eric Adams, some things change more slowly. I did not see a revolutionary
Yeah.
reconfiguration of everything
It's
in the
also
last
nice,
year.
it's nice to see.
Maybe.
You get to know the people and the agencies, what they've historically done, what data they have access to, because I just want to double click the subway thing. I think that was one of the things that I wanted to ask Lucretia about, but then that would have been another, place. I think the subway topic would be a good meeting by itself. Even
Yeah.
If we had.
That's it.
I think the subway topic also relates to the Manhattan Outreach Consortium, because all the various groups doing outreach, and it's more than one. DHS has people that do it, MTA, DHS, and the MOC. Okay.
Even the 6th precinct has people who do that, right?
I'm not aware of that, but maybe, what do I know? There's a lot of check-ins here that I think we should do at some point in the year. We want to do the rounds of our people. Maybe the Red Door Place, maybe the Door, Northwell, Paul's Place, the Village Interagency Task Force, we definitely have to meet with.
I also think circling back to see how Bellevue's doing.
Yes, absolutely. Good idea. And also, I don't know if it merits being top of our list, but Mount Sinai has opened this Rivington Behavioral Treatment Center. So it's a psychiatric center on Rivington Street. And so it apparently is a very nice place. On the other hand, it also does not accept emergencies. It's not a CPAP. I just wonder if at some point we may want to learn more about them.
It'd be good to follow up on the CPAP situation.
Well, the CPAP situation sucks. The
Yeah.
CPAP situation is that Bellevue is the only CPAP in Lower Manhattan. That's now, maybe that doesn't suck. Maybe that's exactly all we need. I have no idea, right? But that's to Janet's point about checking back with Bellevue, because they are.
Can I make a small request? I think just seeing a lot of names that we've talked to in the past, not that I don't want to see them again, but would it be possible to try to make them more succinct, maybe?
Yeah.
Either, just a small amount of time or a report. There's just so much I think that we want to learn and discuss and maybe provide feedback on that. I just want to make sure we have time for that.
Sure. And
Have
we can
we-
also, we don't have to do a meeting for, one item per meeting.
Have we not heard from the center? The LGBT center,
Oh, the center, we've never really met with them. And I've talked to them a
Yeah.
lot over the years. And we can. meet
I
with
remember
them.
last year I emailed them about if they had requests for this. I didn't do that this, but
Yeah, let's,
I'd love to
I think we
see-
should
yeah.
definitely reach out to
Host
the
of
center.
programs, yeah.
Yeah, we can certainly reach out to them. I don't know what they're contracted for.
They're probably pretty well financed.
yeah, let me see what,
Do them together. with the
oh, no, it was 2 years ago.
Who?
Yeah, the chair of this committee actually used to work there. The former chair.
Who's that?
Oh my God, I'm just blanking on his name. I can picture his face. but I'm
Robert Woodward?
Probably.
Robert did. He wasn't the chair of this committee that I remember, but he was definitely worked at the center. Was his
So-
name Robert Woodward? No, Robert. Anyway, lovely man.
In October of 2023, they did send over some, the requests they were making to the city for various initiatives.
Good. All right. So let's make sure that
Poverty,
we
hate
can
crime
meet them, too.
prevention. So it would be interesting to hear from them.
Yeah, and we could mush some of these together. Anything else? It's a lot here.
I mean, we really just do have the one meeting before the end of the year, right? So,
We have one meeting before the end of the year. We have SHAP.
so, I mean, this is
Okay, that's-
enough for us to consider, and then we have to see what happens.
So,
Not on all.
you
of
know,
those, obviously.
I think that we should not be held back
Yeah.
by anticipated
But I think
changes in the city. I think we should just, you know.
we should talk, I agree with that. And I also think we should talk to the government-related people earlier. Like in January and February, we should talk to people who have been doing this work under the current administration, because it will be minimally likely that everything will be changing, whereas we can talk to the service providers in the spring. Like, I would rather meet with, you know,
LaQuisha, for example.
yeah, LaQuisha, for example, like in January as
Yes.
opposed to March, and meet with the door in March rather than January, just because.
Why? I don't get it.
Because I think any changes that the new administration will bring will not have all taken effect by then. So like what they have to say will still be relevant. The programs that, the PATH program and the SCOUT program, and Be Heard, as we're gathering information about what they've seen, they'll still have the information, they'll still be working in.
Would that be an argument for actually waiting? I mean, because any changes that the new administration makes are gonna take a while to sift down. I mean, I would really hate it if all these people were fired and replaced. And if the system, I don't know.
I guess, but the point I've been, gesturing at is that like, I think a lot of the stuff will change. So that if we're like, okay, well, let's talk to some of the service providers in January and February, and then figure out who the right people to talk to are about what's going on in early 2026 under a new administration. It might not be the things we have on the list right now.
But, I mean, the service providers in January may be lame ducks at that point. We don't know. So
That would really be depressing.
We look at sort of the ongoing thing.
The not-for-profits.
Okay, so inverse.
The other way around.
Sure.
Right, things like the door, the LGBTQ set, I mean, these things.
Well, I mean, a lot of these
solid.
things, you know.
The door is not.
If I look at
No.
this, you know, the project, the shelter on West 11th Street, that's not, you know.
It's gonna stay, right?
Bailey House, if they do it, that's gonna be fine. Greenwich House is gonna continue to do what it does. The ecosystem might change, but that's gonna take a long time to change. I cannot imagine an administration being able to change a complex system so very quickly, but whatever. And then these other things are really mostly not-for-profits. The policy question that we have about licensing, maybe that's something that we want to wait on to see if it changes on its own. Although it's a state issue really,
Yeah,
so I
that's
don't.
a long process and a Medicaid issue.
And the question of workforce development, I think is something we could do at any time. And Bellevue has no, it's what happens at Bellevue is really gonna have to do with Bellevue. I mean, not really, but yes. Okay, and then there's something else that may come up at some point, although I fear it, but I also hope for it. So at the Village Interagency Task Force, I shouldn't be saying this. There is talk about something called the Compassionate Intervention Act. And I think there's also talk about this in other states. I think I read something in San Francisco about finding a way to, for compulsory drug treatment for addicts under certain circumstances. And it wouldn't be keeping them forever, it would be keeping them for an extra amount of time. And this is legislation that the current mayor is proposing and would end up being state legislation. It's not city legislation. And it might come up for discussion at some point next year at some point. Might be something we might want to entertain at some point.
It's an interesting idea.
Yeah, it was interesting. The guy, he said, I mean, shouldn't be speaking out of turn, but he said, you know, right now we can keep someone for 7 days. 7 days is what it takes for them to detox. Then we have to let them go. If we could keep them for another 7 to 15 days, they would have come out of detox and they might be able to make a decision for their future. When you're in detox, you're in miserable pain. Last thing you want to do, right? So it's kind of interesting, you know, but of course it raises all questions about civil liberties and who decides.
Right.
But it's, you know.
But who would talk to us about that? Or what is your thinking? I mean, that is a fascinating idea.
I think if it were to be put forth as legislation, we would find out.
Then we-
we'd find out. And that's an example of a policy where it's not an advocacy position. It would really, it would have a very big impact on specifically on our district. It could also be hugely controversial for our district. So
It's getting more support in general, I think. I mean, you just, you know, there's some of the entrenched problems everywhere in the country.
Yeah. I listened to a really great Atlantic podcast. It's like a 3-part series recently.
Oh, really?
Yeah, I'll see if I can find it and send it.
From the Atlantic magazine?
Yeah.
Oh,
And I have super mixed and not firm feelings about this, but it was a really kind of powerful piece where the journalist followed a man who was going kind of in that treatment. Anyways, I'll see if I can find it. No big conclusions from that, just that.
A lot to think about. I keep thinking about when we met with the special narcotics prosecutor, and we were asking about safe injection sites, and this is her perspective. She said, you know, in Rhode Island, they have a model that actually makes sense.
Yeah.
It's a safe injection spot, but it also has all kinds of other.
In the hospital system.
Yeah.
Like, yeah.
And her feeling was, if you just have a safe injection site, you're not going to solve anything.
Well, that was the housing.
Really need a more
that,
comprehensive approach.
Down in Chinatown, because I think, remember the housing and it was.
Yeah,
housing
the two things on the
first,
ground.
But it would have
Yeah.
had a lot of services wrapped around with it.
Yeah. Okay, guys, anything else?
Thank you so much.
No, thank you, all of you, for the time and really good thinking. Thanks for offering to draft a resolution.
Guys.
And please don't let it be something that freaks you out, because I am here and Ryder's here.
We're all here.
Yes, hi.
I just got my card off for you.
Oh, sure.
People want to say, I'm talking about a population that exists in the community.
Oh my God, all the patients that you've had to sit through this. I'm so sorry that we didn't come to you sooner.
Well, I came in a little late, I guess.
You know what I would think, what I would recommend you do? This is really helpful information for people. We have at our full board meeting.
He was.
Hey, really quickly, have you guys adjourned or is this still business to be recorded?
We are just gonna finish the conversation with our visitor and then we'll adjourn.
Yeah, I addressed it.
Oh, you already did?
I also spoke to the school committee and I thought it was pretty service.
Great. Great, thank you very much for this.
It's just, if you want me to come back and we can talk a little bit more about a very important part of the population.
Thank you, I appreciate it. Can you, I have your card. Great, thank you so much. Bye, Terry. This meeting is adjourned. Let's go.